Hello, hello, hello. Good evening, good evening, good evening. It's a wonderful time. Yes, it's an awesome time this evening. Yes, today is the last but one day of the month of November, and it's an honor and a privilege to come to you this evening to your homes to discuss once more again another very important and very common condition in our society. Yes, our previous discussions has highlighted on some very salient, very important conditions in our environment. And today is not an exception. And today we are going to talk about a very, very common condition that I'm sure one of us or most of us have been experiencing. And we don't know about it, but I'm sure we'll be enlightened as time goes on. Thank you very much. May the Lord be with us all. We are starting this discussion in the name of the Father and the Son and the Holy Spirit. Okay, so today's discussion is basically on it's a food condition actually. I'm sure you saw the flyers about and you're wondering what the condition is about. I'm sure we'll delve into it. So today's condition is titled plantar fasciitis. Plantar fasciitis. It spells plantar spelled Plantar. Plantar. And then the fasciitis is spelled Fasciitis. Fasciitis. Plantar fasciitis. Okay, so one may ask, what is plantar fasciitis? It's a foot condition. It's a foot condition, a condition that mainly affects the foot region. So I'm sure, as usual, as time goes on, we will see some pictures depicting or showing the various part or specific parts of the body where the condition is affected. Okay, so today's discussion is the outline for today's discussion is the topic itself, synonyms. That is, when we talk about synonyms, it relates to similar names that can replace this condition. So when we say synonyms, that's what it means. Synonyms, the definition, the prevalence, and how the prevalence means how it occurs in various aspects of our society, the number of people who are affected, and then the anatomy, the pathophysiology, the signs and symptoms. We're going to talk about how we are able to identify this condition, that is through physiotherapy, that's assessment, and then how the person presents when you see this condition. We're going to talk about some causes, some possible causes. We're also going to talk about some special investigation, that is what are necessary to be able to identify this condition, other tests that are done. We're going to talk about the very critical points, that is the management, and then other lifestyle modifications, what we can do to minimize the occurrence of this condition or to reduce the incidence rate or we having it at an earlier stage of life. And then finally we talk about the differential diagnosis, that is other conditions that could mimic or look like this condition. So we're talking about, these are some of the outline, maybe you add some little more to it, but these are the outline for today's discussion. Okay, so we begin from the synonyms. So synonyms, as we talked about initially, is any name that can replace this condition. We're talking about the condition plantar fasciitis. Plantar fasciitis. So another name for this condition is also called painful heel syndrome. So when you hear heel, it means the condition is basically near the heel region, that's the foot region, or heel spur syndrome or runner's heel syndrome. It means people who are run a lot are likely to be predisposed to this condition, if it's a synonym. And we have subcalcaneal bursitis. This is a big word, a scientific word. And we have peritonitis. We have policeman heel syndrome. And the reason why it's called policeman heel syndrome is that men usually stand a lot. If you go to the various traffic lights, you see policemen standing there and walking about, and they hardly sit. They are always on their feet doing something. So this condition is attributed more to them than the normal person who actually, probably the banker who probably sits down for a long time. He or she is not predisposed to this condition, but those whose activity involves walking a lot are predisposed to this condition called policeman heel syndrome, or the topic in question, plantar fasciitis. Okay, so there are so many names that scientifically are attributed, but these are some of few names to this condition. Okay, so now what is plantar fasciitis? We may ask, or one may ask, one is a musculoskeletal condition. That means that it affects the muscles, either the bones, the other structures surrounding the heel region. So we'll show you some picture very soon about where exactly it's affected and what structures are affected very soon. Okay, it's a musculoskeletal disorder which affects a particular part of the heel called the plantar aponeurosis. Aponeurosis is a structure that is supported by muscles and tendons. So it's a musculoskeletal disorder that is after the plantar aponeurosis, and mostly we have inflammation around that structure. So inflammation means there could be swelling around that side, there could be redness, you could see the region around that region, you can see redness around that region, you can also feel pain, the slightest touch or the slightest impact around the heel region, you could feel pain, and when you put your hand there, you could feel some heat around that side. So this are some of the presentation or definitions for this condition. Okay, so after the definition, now we move on to prevalence. So which people are affected? Just like the previous discussion we had on, remember we talked about Achilles tendonitis. It's also a similar prevalence as compared to Achilles tendonitis, that is not gender specific. It could affect males and females equally, irrespective of your gender. You can be a male, you can be a female, you can be predisposed to this condition. Also, a research carried out in the United States of America stated that about 4.6 million people are affected by this condition annually. But as of now, we don't have any statistically evident research that states that we have this number of people who are affected by this condition called plantar fasciitis. We are yet to conduct that study, maybe very soon. Okay, and so another study stated that about 5 to 14% of young athletes or athletes have this condition. 5 to 14% of this of people have this condition, especially the younger generation, because they are known as the active generation. Okay, so now we'll move on to a picture of this condition. Okay, so let's see. Okay, so yes, so we can see, let's zoom into a brighter. Okay, I'm sure we can see it very clearly now. So that is the foot. So everyone has a foot. So this is called, this white thing you are seeing here is called the plantar fascia. Plantar fascia, this white thing. Everyone has some under the foot. Under every human being's foot, we have this structure called plantar fascia. So in the case where there is overuse, that is, you walk a lot or you stand a lot, there's a tendency, there's the probability of you having that side being inflamed. That means being injured. And so when you have this structure, around the structure, you can see this reddish pink mark here shows that there has been an injury there due to probably you hitting your leg or something, or you engaging in activity for a longer period of time. So this is a plantar fascia, and this the reddish side is where we have the injured side, so the area of the pain. So when you put your hand on under the person's foot here, the person complains of pain, and even movement of the foot in a particular direction, either forward or backwards, has a tendency of causing pain. And you could see the heel here. So this structure called the plantar fascia connects from the toes right onto the heel. So there'll be other pictures showing you. Okay, so you can see a very clear picture of that here. So this is the plantar fascia. So you can see it runs right onto the toes, right here, so it covers it. And this is where there's injury there. You could see the injury here, the reddish orange sign here. Okay, so Yes, so this is, so the person presents with pain around the side. So we can see here. Okay, so another picture here, so we can see the structure here being inflamed, the plantar fascia being inflamed. Okay, so this is another very good picture of the plantar fascia. You can see it. This is a plantar fascia, the whitish structure there. Okay, we want to just have a very good picture of it. Another one too here, the plantar fascia. This is the reddish sign, is where you have the inflamed portion, and this is the normal foot, and this is the inflamed foot. Okay, so let's look at one more picture so that we can appreciate it more. Okay, so this is another one here. You have the reddish sign indicating that there is a stretch or a tear in the structure called the plantar fascia, and then the doctor or the physiotherapist will diagnose the patient as having plantar fasciitis. Okay, so I'm sure we are getting into the discussion and a picture of this presentation. I'm sure we are getting it well. Okay, so yes, we've talked about the definition, talked about the synonyms, talked about the prevalence, and now we've seen some anatomy. So around the structure of the foot, we have so many structures there. We have muscles, we have tendons, we have ligaments, we have vessels, we have bones, so many structures around the foot. But the main structure that we're talking about is the plantar fascia. So when there is injury around the side, the doctor or the physiotherapist will diagnose the person as having plantar fasciitis. Okay, so now let's talk about the pathophysiology. So what's the condition itself, and what does it do? How does it mimic itself? How does it look like? So first of all, we could see that there is something we call inflammation. That is, we have swelling or pain around that side, and movement is very difficult. Sometimes the person cannot even step on the heel, and so if the person has this presentation, the person reports to the appropriate medical personnel, and then we treat them accordingly. Okay, so what are the signs and symptoms of this condition? Okay, there are so many signs of the symptoms of this condition. You could have pain around the region of the heel. We could have the pain worsening when the person steps on the heel, or even directly on the foot. There's very difficult pain, and then the pain also becomes very severe early in the morning, but as the person walks or takes some walks, the pain comes down as compared to the earlier morning pain. Also, with intense activity, that is continuous activity, the pain resurfaces again, the pain becomes more severe again, and actually this pain could persist for weeks, for months, and sometimes even for years if not taken into consideration or treated or managed accordingly. The pain could be piercing, so it's the person or the patient can be saying that, oh, the pain is, I feel the pain like a piercing pain, like someone is pricking me, and then the pain also can be throbbing. It could be piercing or throbbing, and also the pain is noted to improve with rest. So when a person walks for some time and sits down and rests a little, the pain goes down and continuous activity. Okay, and then also with continuous activity, as we mentioned earlier, the pain becomes very worse. So when the person comes to see a physiotherapist, there are various tasks that we assign the patient or the patient to do. So we call something variable task. So we'll ask the person to probably stand for some time during activity and sit down for some time during activity in order to manage the pain, and then further strengthen the structure with activity or various specific exercises. Okay, so the pain is basically to the inferior medial aspect. So infomedial, when you say infomedial, if this is your foot, inferior means the one closer to your opposite foot, and then medially inferior means the one in front, that is closer to your toe, and then medial means the one closest to the opposite foot. So if this is your foot, it means the one in front moving this way, and then medially means moving towards the side. Okay, so it means basically affects the inferior part of the foot. Okay, so after these signs, yes, we could have also tenderness. So with the slightest touch, the person complains of pain because of the structure that's affected. Under the plantar fascia, we have a structure we call tendon. So the slightest touch, the person feels tenderness around the side. Okay, so when you come to see a physiotherapist, we are going to go through some assessments with you, but we will note some changes in your foot as you come to see a physiotherapist. Okay, so we could note that for one person, the person could have excessive supination. Supination means opening up. So if this is the foot, we have your foot can turn inwards like this, and foot can turn outward like this. And some patients or some people have their foot turn outwards. That is supination. So they can't put their foot, the inner part of the foot, on the ground. And some people also have their foot turn inwards, and as such, the foot, that's the outer part of the foot, is not able to hold itself upwards. And the fact that you are turning your foot inwards, it could have a condition we call flat foot. But I'm talking about this condition. So the person with plantar fasciitis could compensate by having the foot turn inwards, and then also it could be also turn outwards. Okay, so also one of the very important signs of this condition is that when you try to bring the foot up, that is stretching the structures under the foot, the person complains of severe pain. That could imply that there is injury underneath the foot. Okay, so aside that, we are going to now talk about the possible causes of plantar fasciitis or Pleesman's heel syndrome. So I think this is very common for, I'm sure you won't forget this name, Pleesman's heel syndrome. Plantar fasciitis might be too big a word for you, but when you remember Pleesman's heel syndrome, I'm sure we can relate to this condition. So what are the possible causes of this condition? There are three main subcategories of the possible cause of this condition. We have the intrinsic. When we talk about intrinsic, it means what is inside the foot that brings about this condition. And we talk about the extrinsic, the external factors that could cause this condition. And then finally, the anatomical presentation of this condition. So first of all, we're talking about the intrinsic. So what are the causes of this condition relating to the fact that it's intrinsic? One, when the person or the individual is advanced in age. So as we grow old, we are likely to have under our foot wear. We call it wear and tear. It could tear, and this could result in this condition called plantar fasciitis. Also, if you are a high BMI means body mass index. So if you are tall and also you are heavy in weight, when we calculate it by your weight over your height squared, when we calculate it, there's a range that when you fall in, you are termed obese. So obesity, if you are obese, you are likely to have this condition called plantar fasciitis or Pleesman's heel syndrome. Also, there could be also tight Achilles tendon. Remember in our previous discussion, we talked about Achilles tendon, the tendon that holds the back of the foot in place, and then as we walk, it gives us strength. So if there is tear in this structure, if there is tightness in this structure, it will cause the injury to the plantar fascia, and then it will result in plantar fasciitis. Okay. Also, if you have one leg longer than the other, this could also cause you to have plantar fasciitis, because if one leg is longer than the other, the heel of the other leg that is short won't touch the ground. It's very difficult to touch the ground. So then there could be tightness around the structure called the Achilles tendon to the plantar fascia, as we looked at the pictures previously. We'll be seeing the pictures again in the middle of our presentation. and then we could have plantar fasciitis. Also, the person might have a short leg, and then will have high impact of the short leg on the ground if the person decides to walk that way, and this could also cause inflammation to that structure called the plantar fasciitis. Okay, so we've talked about the intrinsic causes, that are inside causes. Now, what are the outside causes called the extrinsic factors? First of all, the use of poor footwear. So if you wear footwear that are very flat, there's a likelihood that there could be impact onto the foot, under the foot, and this could cause an early condition called the plantar fasciitis under the foot, that is injury to the plantar fascia. Also, the type of or intensity of your daily activity. So if your activity involves you standing a lot or walking a lot, this could increase the rate of having this condition called plantar fasciitis. And also, we have isolated or repeated trauma to the foot surface. So in case probably you jump from a high height and then you step on the ground, it could have this structure under the foot called the plantar fascia injured and could have plantar fasciitis. Also, we have another factor cause called the anatomical cause. One, someone could have flat foot. So when we talk about flat foot, just a gist of it, I'm sure we'll be talking about it in our next presentations, one of our presentation in the next few weeks. Okay, so first of all, one could have flat foot. Scientifically, it's called pes planus. Pes planus, yes, flat foot. And if someone has flat foot, normally we are supposed to have a small curve inside the foot so that it will prevent direct impact or force as we walk. But some people don't have that curve or that hole under the foot, and then this could also increase the tendency of this structure called the plantar fascia to get injured, and this could cause plantar fasciitis. Another reason will also be someone having pes cavus. That is the fact the person could have high heeled or high arch foot. So the inside part of the foot that is curved, there could be exaggerated or too much raise of the foot inside, and this could cause high impact around the heel region, and this could cause plantar fasciitis, that's injury to the fascia. Okay, so it is noted that also elderly people can be predisposed to this condition because they have their structures not so strong enough to hold the body in place, and also non-supportive or inappropriate footwear by elderly people tend to have them predisposed to this condition. Okay, so after everything, we are supposed to be able to use various tests to be able to confirm this condition, and some of the tests include using ultrasound. So ultrasound is a non-invasive, that is, it doesn't really cause too much distraction to the tissues around the structure there, and this helps us to see whether there is inflammation or there is any further injury to the structures at the heel region or surrounding region. We could also take x-rays, and this helps to see whether there's any fracture around the side so that we can isolate and treat it accordingly, including the likelihood of having plantar fasciitis. We could have a bone scan, we could have MRI, which gives us the opportunity to see detailed structures around the heel region. Okay, so these are some of the various tests. We can have blood plasma therapy, we could have nerve conduction studies, we could have so many tests, blood tests, that will help us to rule out other conditions that are likely to be a cause or could be a factor. Okay, so then there's one statistic that stated that 50% of people with this condition called plantar fasciitis have the tendency of being re-injured again. And so if you are treated or the pain goes away, you could have this condition again. So now we talk about our next subtopic is the management. So what can be done for this condition called plantar fasciitis? First of all, it's very important that when you feel pain, you report the pain as early as possible, or you give a first aid treatment that we call RICE. Means one, RICE means rest, ice, compress, and elevate. So immediately you feel the pain around the heel region, you get some ice blocks, some ice cubes, and then put it around the side. Only if you shouldn't use ice when you have the place being exposed. That's when you see blood around that region coming out. Don't use ice. When the place is inflamed or you can see some red signs and with pain, the first thing to do now is to use ice, and then you minimize activity. You don't walk, you just relax for some time, maybe the whole day, and then you compress. That is, you can use bandage to rub around the heel region or even the whole foot. Then you elevate, that is, you put your leg on something high to allow blood flow back into your heart. After these things, you can now then report to the health professional, the medical doctor, the physiotherapist, so that we can treat you as accordingly. After this, we are going to go through various exercises. We are going to go through stretches. We are going to go through use of a structure we call TheraBand. So when the pain goes down with ice, we could use hot pack. We could use also the ultrasound for treatment. We could use TENS, that is trans-electrical nerve stimulation, to relieve the pain around the region of the heel. We could use so many electrotherapy devices to reduce the pain. Then after that, we go through exercises. We have a ball that we use, and we'll be showing you the picture of the ball very soon. That we put the heel on the ball, and in this process we move the heel around on the ball to relieve pain, to also help to relieve any stiffness around the heel region or any likely swelling around the heel region. Okay, so when all is said and done, there are other therapies that are done. We could have acupuncture, we could have soft tissue therapy, that is, we could have some massage around the foot to relieve swelling or pain. We could have also corticosteroid injection, that is, we could have injection around that region to relieve the pain. We could have also giving you NSAIDs, that is inflammatory medications, to reduce the pain and the swelling. And then most importantly also, we could have a treatment we call taping. So we have a tape that we wrap around the foot region to the leg region to help to release any tension, to strengthen the structures around that region, and then to relieve pain, most importantly, that is taping. At a later stage, we could have the use of foot orthotics, that is specifically designed shoes to prevent high impact of the foot on the ground, and this helps to improve our daily activities of living. Okay, so another one treatment is we could have a night splinting foot. Yes, it's a special foot that when you're going to sleep, you rub or you put on your foot that stretches to the leg region, and this helps to prevent your foot to drop or your toes also to drop, because there's likelihood of injury to the plantar fascia, and this is very important for people with severe pain of this condition called plantar fasciitis. Furthermore, when so many things are done, therapy is done, we do ice, and the pain is still persisting, is still there, then we move on to surgery. So surgery could be a release. We could have a plantar fascia release. We could have so many options that the surgeon could opt for. After surgery also, we come back to see the physiotherapist to be able to resolve and return the person to activity. Okay, so there could also be excision of the structure there, and then resection or excision of the abnormal tissue in case there's abnormal tissue around the structure, that's the plantar fascia, so that the person can be able to perform activities as best as possible. Okay, so what are some of the lifestyle modifications to this condition called plantar fasciitis or policeman's heel syndrome? So what can we do? We also try to minimize walking. So our day-to-day activities should be varied, that we walk for some time a long distance, we rest for some time, and then try to play away with this walking and then sitting or relaxing for some time. Also we also have to also report any slight pain that we feel around our heel region as early as possible, so that it doesn't aggravate or it doesn't become worsened to become so severe that it becomes chronic and then less treatable. Also, we also advise that athletes wear prescribed attire or prescribed shoes to be able to effectively carry out their sport and then minimize the tendency of injuries to the heel region. Okay. So finally, we talk about some of the differential diagnosis. That is some condition that could look like plantar fasciitis, and then we have to take note of. We have tibialis posterior syndrome. We have referred pain as a result of injury to a vertebrae around the waist region, called S1 radiculopathy. We could have calcanea or navicular foot pad injury. We could have peripheral neurogenic pain. We have tibial nerve related pain. We have trigger point pain. So these are some of the scientific terms of some condition that could look like this condition called plantar fasciitis, and probably in our next few weeks we'll be talking about some of these conditions, and then we can compare them to this condition called plantar fasciitis. Okay, so it's been a wonderful time, and let's look at some pictures before we wrap up with our topic for today. Okay, so you can see some of the pictures now. Yes, so these are the plantar fasciitis. Yes, you could see the heel here, you could see the inflammation here, you could see, yeah, I'm sure you can see it now. Yes, you can see the inflammation, the swelling, the redness here. Okay, so you can see some pictures here. Okay, you can see the redness here. Okay, you can see the person complaining of the pain here. Look at the whole place being red. So this could imply the person has plantar fasciitis. So this is inflammation of the structure they call the plantar fascia. And we have these are the bones. We have the Achilles tendon here. We talked about the Achilles tendonitis here, the last presentation before today, Achilles tendonitis. But we're talking about plantar fasciitis today. That is inflammation of the plantar fascia. This is the plantar fascia. So it holds the whole foot together and helps us to walk without shifting or falling to the left or to the right. And this is the calcaneus bone. That's the heel bone. It's a very, very important structure for us to also walk very effectively. Okay, so this is also the plantar fascia. We can see the plantar fascia here. Yes, I'm sure we can appreciate it more. Okay, so this is a plantar fascia swelling there. Another picture, we can see very clearly the swelling of the plantar fascia. Another one here, we can see it here. Another one here. Okay, so these are some of the exercises that as a physical therapist, when you come, you will teach you how to do. So you have the standing on your toes and then going down and up. So this also helps to stretch and strengthen this structure called the plantar fascia under your foot. Okay, so these are some of the research that was carried out. It's one out of 10 people tend to have this condition, and other researches that were carried out. Okay, so you can see a physiotherapist trying to stretch the structure there called the plantar fascia, and this helps to relieve the pain and also improve the function of the foot. Okay, so this is someone also complaining of the pain under the foot. So this is what I was talking about, the ball. It has some dots on it that helps to improve sensation, relieve pain and then swelling under the foot. Okay, so I'm sure now we can understand what I was talking about initially. Okay, so yeah, so this is the ultrasound. This is the ultrasound I was talking about. Ultrasound. So you move it round the foot and this helps to relieve pain and swelling and improves upon function underneath the foot. Okay, so this also how it looks like the swelling or the injury to the plantar fascia. Okay, so these are some of the characteristics of the pain. So you see the pain here. So the pain reduces with activity. So when the person lies down, sits down, there's no pain, and the person complains of pain when walking or carrying heavy devices. And the pain also becomes severe in the morning, as we talked about initially. So this is the pain site under the foot. Okay, under the foot. So we can see the plantar fascia. The whole structure here is called the plantar fascia. Okay. So this is a foot orthotics. I mentioned it earlier on. That helps to reduce the impact of the foot on the ground. So it's also a very important device that helps. So these are one of the it's a types of massage to help to relieve any tension around the leg region. So this is the plantar fascia, and this you can see the injured plantar fascia there. You can see another one here. So this is another ultrasound. Though it's an old type, but it's also effective to help to reduce swelling of the foot. Okay, so this is the TheraBand I was talking about. Yes, TheraBand. That helps to strengthen the foot. So you pull it forward and then they push the foot backwards, and this helps to strengthen the foot and helps to return to activity. So this is a ball again. Once more again, this is a ball. Okay, so this is the foot. This is anatomy of the foot. These are the yellow ones are the nerves. They are nerves. This is the plantar fascia. This is the heel pad, and this is the Achilles tendon. This is Achilles tendon. Okay, so we can have medications. That's the NSAIDs. We could have the use of supportive devices as the heel pad in your shoes. You could also use ice to relieve the pain, and then you can stretch the structure called the calf muscle, and this helps to strengthen the plantar fascia. So this is some of the exercises that a physiotherapist will go through. Tiptoeing, you sit down and raise your toes up and down, and then you stretch, and this is called. Okay, so these are some of the exercises that we do to be able to strengthen. So this is the ninth splinting I was talking about. I'm sure now we can see and appreciate what I was talking about, the ninth splinting. Okay, so this is also a roll to help to strengthen or to stretch and relieve pain around the foot. Okay, so this is the anatomy of the foot. Okay, all right. So so we're seeing the picture there. Okay. Okay, so sorry. Okay, so so furthermore, we thank you very much for your time. It's been a wonderful time. Talked about plantar fasciitis and then the related matters concerning it. Please, do you have any questions? Any questions as we wrap up on our discussion called plantar fasciitis? Any question? You have any question? Okay, so thank you very much for your time and everything, and I know we've learned a lot. So our next topic for discussion is called iliotibial band syndrome. iliotibial band syndrome. Yes, I'm sure that we've not heard it before, but we'll learn a lot from this next topic. So our next topic is iliotibial band syndrome. Thank you very much for your time, and we are trusting God that we'll learn a lot in our next discussion. Today's topic was titled Plantar Fasciitis, also known as Plees-Hillman syndrome. Thank you very much for your time, and may the Lord be with us all. May the Lord protect us throughout the week. May the Lord guide and protect us and cover us in the blood of Jesus. Thank you very much. Have a blessed evening. Take care. Goodbye. See you. Have a blessed week. Take care.